guys. Good morning. It is cold here. The microphone is cold, so that's why I'm holding it down here. I hope you guys are warm wherever you are. But welcome to our eLotus webinar today. My name is Donna, and I will be your host and your moderator for today's class. Here at Lotus Institute of Integrative Medicine, we are the leading acupuncture CEU provider offering the largest selection of CEU online courses. So what that means for you is that you can choose courses that you find interesting and you can apply in your clinic right away and earn CEU credits too. Every week we do a weekday webinar such as today's class, and it's free for practitioners and as well as TCM students to attend. And it's educational, it's free. It doesn't include CEUs, but eventually we do submit them for CEUs later on as a video recording. Today's class is a series that Dr. Chen will be doing. Today is on exterior releasing. So this class and the series is designed for people who may not be familiar with herbs, because some acupuncturists, they don't take herbal classes when they are in school, or if you did take herbal classes and you need a refresher, this is a great series to take, and Dr. Chen will be doing this once a month. So Dr. Chen is a recognized authority in both Western pharmacology and Chinese medicine. He is the lead author of Chinese Medical Herbology and Pharmacology and Chinese Herbal Formulas and Applications. Both books are currently listed as required text for the California State Board and NCCAOM. Dr. Chen is currently a medical consultant over at Evergreen Herbs. So if you have any questions about your patients on what herbs that would be best for them and you need a little help, please feel free to contact Dr. Chen and even Tina Chen at Evergreen Herbs. They're both available for you. All right, guys, so let's go ahead and get started with today's class.
All right. So this is the first of 12 series of classes on the introduction to Chinese herbal medicine. And we're going to start with exterior releasing herbs. Okay. As I mentioned before, in Chinese medicine, humans live between heaven and earth. And all the diseases that we get are either from the exterior or from interior. Exterior refers to the exterior pathogens. And in Chinese medicine, that includes wind, cold, heat, dryness, dampness, and so on. Okay, and interior refers to the yin and yang balance or imbalance of the Zangfu organs. All right, so that could come from poor diet, that could come from overtaxing of somebody's body, from physical lifestyles, and so on. Okay, so all the disease are either externally contracted or internally generated. So with exterior syndrome, what happened is this is a disease or this is an illness that come from the exterior pathogens. All right, so generally speaking, these conditions are characterized by exterior wind, cold, or wind heat that start to attack the outer superficial layers of the body, namely the skin and the muscle layers. And they cause signs and symptoms such as aversion to cold, aversion to wind, fever, headache, muscle aches and pain, inappropriate presence or absence of sweating or perspiration, and a superficial pulse. Okay. Of all these signs and symptoms, generally speaking, the most diagnostic or the most important is going to be aversion to cold and a superficial pulse. So superficial pulse tells us that the disease is mostly at the exterior. Aversion to cold tells us that this is a superficial wind condition. Could be either wind cold or wind heat. All right, so aversion to cold and superficial pulse, if they are present, generally tell us that this is an exterior syndrome of some type. And then, if you need to differentiate or more clear differential diagnosis, exterior syndrome is then divided into exterior wind cold or exterior wind heat. Okay, and exterior wind cold, patient will have a more cold dominated signs and symptoms, including aversion to cold, fever, absence of perspiration, headache, body aches and pain, thin white tongue cold, superficial type pulse. All right, so cold, especially aversion to cold, is the main diagnostic symptom. And then if the patient has wind heat, the main signs and symptoms are fever, mild aversion to wind and cold, dry and sore throat, thirst, thin and yellow tongue cold, superficial rapid pulse. So in this case, you can see a lot of the signs and symptoms are more indicative of heat, all right, such as fever. The aversion to cold and wind becomes milder, not as severe. And then as heat begins to attack superficial and starts to go interior, then the patient are likely to have sore throat. Okay, and the pulse is going to be somewhat rapid because of the heat nature of the illness. All right. From a Western medicine perspective, generally speaking, patients with exterior wind cold or exterior wind heat are said to have common cold, influenza, or upper respiratory infections. All right, so that's generally how the two conditions overlap with each other. All right, so if the patient has an exterior condition, then the herbs of choice to use are the herbs that release the exterior or exterior releasing herbs. So these are the herbs that are generally said to dispel wind cold or dispel wind heat from the superficial parts of the body. And once the wind cold or the wind heat are dispelled, then the patient can return to their normal physical state. All right. So exterior releasing herb make up the chapter 1 of the Chinese Materia Medica. And then within this chapter, you have herbs that are acrid and warm, that specifically dispel wind cold, and yet herbs that are acrid and cold to specifically dispel wind heat. Okay, so those are the two subcategories of herb to treat the two differential diagnosis conditions. All right, so here are some examples of herbs that are acrid and warm and dispel wind cold. The two herb examples, one is Ma Huang, Herbal Ephedra. Second one is Gui Zhi, Ramulus Cinnamomi. Okay, and one example for the formula is Ma Huang Tang Ephedra Decoction. So as you can see, we are kind of going through this in a integrated manner. Okay, meaning if you were in school, generally what you learn is first semester or first year is introduction to herb and single herb. Right, so you learn about single herb, and then the second year is usually herbal formulas. So you learn all the same chapters in herbal formulas, and then in the third year, there may be the clinical applications. Okay, but one drawback of that is obviously as you learn single herb the first year, and by the time next year come around, you may have forgotten a lot about the single herbs. And if you do that, and then by the third year, when you learn about clinical applications, once again, you might have forgotten a lot of the first 1 or 2 years. So hopefully this is a slightly different way to integrate and talk about them all at the same time. Okay, so we learn about single herbs, about formulas, and about clinical applications. And obviously one of the drawbacks is that when we talk about clinical applications, the formulas will contain herbs in the exterior releasing category and also other categories, but we might not have touched on those yet. Okay, but in any case, any style have some pros and cons. Hopefully, we find this way to work for us. All right. So anyways, herbs, if the patient has an exterior condition, especially they have exterior wind cold, then generally speaking, you need to use acrid and warm herbs and acrid and warm formulas in order to dispel wind cold. Okay, and if the patient has wind heat, then we need to use acrid and cold herbs in order to dispel wind heat. And those examples would be Jinninhua, Lanesura flower, Lian Qiao, Fructus Forsythiae, and then those are the two main ingredients in the formula in Qiao San, which is honeysuckle or Lanesura and Forsythia powder. Okay, and we'll go through all these single herbs and formulas in greater depth. All right, so in this case, Ma Huang is generally the very first herb that we learn in school. Okay, and then Ma Huang Tang is the very first formula we learn in school. All right, so Ma Huang is an herb that's described to release the exterior condition through diaphoresis. And what that means is it induces sweating, and as you sweat the disease out, so as you sweat it out, the wind, the cold will also be dispelled at the same time. Okay, so that's the rationale behind using Ma Huang to induce sweating and to dispel the exterior wind cold. Okay, Ma Huang also has effect to go into the lung and also to relieve wheezing, dyspnea, and stop coughing. Okay, so it's not just something that treats the superficial layer, the skin or the muscle. It also treats disorder of the lung as well. Okay, from a pharmacological perspective, Ma Huang has a diaphoretic effect, has an antipyretic effect, and also has an anti-asthmatic effect. Okay, so diaphoretic, once again, means to induce sweating. Okay, and as far as sweating goes, our body really have two main ways of sweating. One is sweating through stimulation. All right, so Ma Huang induces sweating through stimulation. It increases your metabolism. Okay, Ma Huang stimulates your metabolism, elevates your metabolism, and then we start to sweat more. So it's kind of like if you were to exercise, if you were to go on the treadmill, if you were to go jogging, your metabolism goes up and you start to sweat. Okay, so that's a more direct type of sweating. The other type is when somebody's nervous or anxious, right? And then what happens is your sweating is mostly in your palms, right, and in your feet. Okay, so not so much of an overall entire body perspiration. All right. Anyways, Ma Huang induces metabolism, elevates metabolism, and in turn causes sweating. Okay, and its antipyretic effect, which is an effect to treat fever, is also directly tied to sweating. Okay, so what happens is as sweat comes out, the skin pore opens. Okay, the patient also dissipates heat as well. All right, and you have to understand that. Otherwise, it may not make sense because Ma Huang is a warm herb. You wouldn't normally think of a warm herb to help to lower fever, which is a heat condition. All right, and lastly, asthma, anti-asthmatic. From a Western or from a TCM perspective, it ventilates the lung. It ventilates the lung qi outwards to help with breathing. From a Western medicine perspective or pharmacology perspective, Ma Huang has a lot of ephedrine alkaloids, and that, when it attached to the lung receptors, causes stimulation and dilation of the lung, and basically helps to overcome the asthma and the bronchial constriction. So Ma Huang is in fact one of the best medicine to treat asthma, dyspnea, shortness of breath type of problems. All right. The main caution with contraindication of Ma Huang is that when you do take it, it doesn't just go to the metabolism and induce metabolism and open the skin pores, and it doesn't just go to the lung. What happens is when the ephedrine alkaloids are in the blood, they do circulate and they go to many different parts of the body. So now what happens is when the ephedrine alkaloids go to the brain and stimulate the central nervous system, patient will tend to get more agitated, more irritated. They will tend to become more restless. They may have insomnia. Okay, when the ephedrine alkaloid goes to the heart and affect the cardiovascular system, it will stimulate the heart to increase heart rate and elevate blood pressure. Okay, so those are generally considered to be the main side effect and adverse reaction associated with Ma Huang. So the desired effect is to induce sweating, is to dilate the lung to treat asthma. But when Ma Huang goes to other parts of the body, then they cause the side effects. All right, so once again, effect and side effects are almost something that goes together hand in hand. You really cannot have one without the other. Okay, so if the patient is very sensitive to Ma Huang, okay, and even within normal dose, they tend to suffer side effect. Or if the patient is taking a very large dose, let's say, for, recreational purposes or to induce weight loss, then what happens is the risk of overdose then becomes a lot higher. All right, so historically, if Ma Huang is overdosed, then these are the examples of herbal antidote. All right, so there are two examples. One is a more comprehensive formula, and the second one is more of a generic antidote. But in any case, these will help to treat the adverse reactions associated with overdose of Ma Huang. Okay. Another thing you also want to be careful with, and that is with herb-drug interactions. All right. So once again, Ma Huang, as I described, is a warm, hot herb, right? And warm and hot herb generally tend to have a more strong stimulating type of effect, right? So it stimulates the lung to treat asthma. It stimulates the heart, but may cause increase in heart rate and increase in blood pressure. So if the patient has a cardiovascular condition, it's best to be careful with Ma Huang. If the patient is taking an alpha blocker or beta blockers, right? So alpha blocker and beta blocker may be used to treat hypertension because they block the cardiovascular system and lower blood pressure. Now what happened is Ma Huang, you can think of it as a alpha or beta agonist, right? So they stimulate the heart and they stimulate the lung. They will then cancel each other's, right? So that would be one example of herb-drug interaction where Ma Huang adversely interact with alpha blockers and beta blockers. And some example may include catapres, tenormin, okay, type of alpha and beta blockers, all right? You also want to be careful when you use Ma Huang with drugs that have the same effect. So drugs that are also stimulants, okay, such as caffeine, such as theophylline, such as monoamine oxidase inhibitors, or thyroid medications, right? So any of the drugs that have a strong stimulant effect, you have to be careful using Ma Huang because Ma Huang also have a stimulating effect. And when you combine them together, then they could become too potent or too strong for the patients, all right? So basically what happened is once you understand the pharmacology of the herb, you should be able to easily see how drug-herb interaction may occur if you also understand the pharmacology of the drugs. All right, so in terms of understanding of the interaction, I think it's important to know the herb beyond its TCM description, beyond releasing the exterior, but exactly what does it do. Also, from a drug perspective, if you are a TCM practitioner, know beyond the indication of the drug. Don't just say, oh, this is a drug that treats hypertension, okay, and think, well, does it interact with Ma Huang? Maybe, maybe not, because drugs that treat hypertension also fall into many different categories. Some are alpha and beta blockers, some are vasodilators, some are calcium channel blockers, some are ACE inhibitors. Okay, they don't work the same way and they don't interact with other drugs or herb the same way. All right, so for TCM, you need to learn beyond the TCM description of its functions. For drugs, you need to learn beyond the indication of the drug, but learn the pharmacology of the herbs. That way, understanding herb-drug interaction will become a lot easier and a lot of time will become self-explanatory. All right, so that's the very first herb, Ma Huang. And the reason I spend more time on it is because I'm hoping many people that are watching this, in your country, Ma Huang is still available. And also in the US, I'm hoping one day Ma Huang will be allowed by the US FDA again. All right, but nonetheless, it's the first herb that we study in school. It's a very important herb, so it's important to know about it from academic and also historical purposes. The second herb that we generally study in school is an herb called Gui Zhi, Ramulus Cinnamomi. So this is basically the cinnamon twigs, the branches. The primary function is to release the exterior through diaphoresis. All right, so this is same as Ma Huang, to dispel the exterior pathogen by inducing sweating. And the second function is to warm and open the channel and collaterals, or meridians and collaterals. All right. So I don't know if you ever wonder, okay, what does that actually mean? What does that actually do? Okay. And one of my favorite thing to do, as a hobby, is to look at Chinese medicine from Western medicine perspective and look at Western medicine from Chinese medicine perspective. And I think that's very important to see it from both different angles so you can begin to put the whole thing together. All right. So what Chinese medicine often describe as warm at the channels and collateral, oftentimes is that these are the herbs that have function to increase blood circulation to the peripheral parts of the body. These are the herbs that increase blood circulation to the peripheral parts of the body. Not as an anticoagulant or antiplatelet type of way, but mainly as a herbs that increases the vasodilation, that increases the microcirculation, and also to some extent some herbs have angiogenic effect, which means actually increase the direction and location and the number of fine blood vessels to the peripheral parts of the body. All right. So the first function of Gui Zhi is to release the exterior through diaphoresis. So that part is about the same. It has diuretic effect to induce sweating. It has anti-pyretic effect to treat fever. And once again, this is through vasodilation and the dissipation of heat. So from that regard, the TCM description of Ma Huang and Gui Zhi is about the same. And once again, Gui Zhi is a warm herb. Okay. Opens the channel and collateral mostly because it helps to improve and promote the blood circulation to the peripheral parts of the body, to the distal parts of the body. All right, and together they make up the formula Ma Huang Tang Ephedra decoction. So the first two words, Ma Huang and Gui Zhi, are used together, so they have synergistic effect to induce sweating even more effectively than either one of the single herb can do. Then, 苦杏仁, bitter almond seed, is to direct lung qi downwards. So if the patient has wheezing, dyspnea, shortness of breath, Ma Huang will help to relieve those lung qi signs and symptoms. And then lastly, 炙甘草 licorice is to harmonize the entire formula. Okay, and then very quickly, the TCM description is Ma Huang Tang helps to treat the exterior wind cold syndrome with all those signs and symptoms listed. And then exterior wind cold syndrome is primarily common cold, influenza, and upper respiratory tract infection. All right, so I'm going to pause here and ask you a question that I have asked myself for a long time. And that is, wind or wind cold does not literally cause the infection. Wind or wind cold is not literally the virus or the bacteria. Okay, so if that's the case, okay, Ma Huang and Gui Zhi really have the strongest effect to induce sweating. They really have very little effect as antibacterial or antiviral. Okay, if that's the case, then why do we use herbs that induce sweating that have little or no antibacterial or antiviral effect to treat a viral infection or bacterial infection? Right? So as a pharmacist, this will make absolutely no sense to me. Why don't we just go right into and use herbs that treat bacterial and viral infection? Why do we use herbs that induce sweating? That makes absolutely no sense, right? But what happened is this is a formula that is put together by Dr. Zhang Zhongjing, right? And he is the person that authored the book Sang Han Lun on cold-induced disorder. And many will tell you that he is probably the best TCM practitioner in the history of Chinese medicine. So why would he do this? What's the point of inducing sweating? What's the point of releasing the exterior? Okay, so this is my understanding. My understanding is that even though cold does not literally cause bacterial or viral infection, the cold temperature or the cold environment affect the human behavior and affect the human body, and therefore make it more vulnerable to a common cold or influenza. All right, so what happens is when the weather starts to get cold, right? And once again, you have to imagine that this is ancient China, maybe some 2,000 years ago. So the living condition is completely different from today, right? So when winter comes and it becomes very cold, then what happens is everybody would then gather around a small place, right, in order to stay warm. And at the same time, back then, they probably turn on the fireplace, turn on the fire in order to gather warmth. And today, mostly we turn on the heater, okay? But in any case, what happened is when we all gather around a smaller place, indoor, and not go outdoor and close all the windows, then obviously what happened, as we know, is that if one person is sick, then the bacteria and virus is passed on to another person much easier because of the proximity of the people to each other's. All right. Another thing that happened is as people turn on the heater and turn on the fireplace, that the heat will dry up the humidity in the air. And then what happens is the viral particles will float and suspend in the air for much, much longer in dry environment. And once again, will facilitate the passing from one person to another. Okay, and then at the same time, the heat and the fire dry up the moisture in the air and subsequently dry up the mucus lining inside the nose and also in the respiratory tract. And your mucus lining is actually one of the first defense to trap the bacteria and trap the virus. And then you have the mucociliary reaction that always propel outwards through sneezing, through coughing, and so on to get rid of it, right? But what happens is when it's too dry, when it's too warm, your mucus lining, let's say it used to be this thick, is now dried up. So it becomes a lot thinner. So the distance to travel from the outside to the inside for the bacteria or the virus is a lot less, and therefore it's much easier for the bacteria or virus to go through that distance, get into the blood, and then affect the person. And at the same time, the thickened mucus lining also causes a mucociliary reaction. The little, finger-like particles, they don't move very effectively to expel the bacteria and virus. All right, so it affects, once again, the cold temperature and the subsequent fire and heater affect the human behavior, where everybody gather at a very close place. It also affects the human body and the physiology. Okay, in that viral particles suspend a lot longer in the air, your mucus lining becomes a lot thinner, your mucociliary reaction becomes obstructed. Also, the cold will cause vasoconstriction, right? Because when it's cold, your body wants to preserve the blood to nourish your vital organs. And in the process, cause vasoconstriction and is willing to sacrifice the fingers and toes. Because after all, your heart, your lung, your liver is more important than your fingers and your toes, right? But what happens is when it cuts off blood circulation to the peripheral parts of the body, it also cuts off blood circulation to the blood vessels, to the nose, to the upper respiratory tract, right? So now what happens is you have less oxygen, you have less nutrients, you have less white blood cell, you have less macrophages. That goes to the peripheral parts of the body to defend your body against these foreign microorganisms. All right, so the cold temperature will cause more stress to the body, will affect the immune system, and therefore make us unable to defend ourselves against the bacteria and virus in a normal fashion. All right, so while cold does not literally cause virus or bacterial infection, cold affects human behavior, affect normal body function, and therefore make our body more vulnerable to a bacterial or viral infection. All right, so what happens is in the very early stage of wind cold, think of it as the very early stage of the bacterial or viral infection of the common cold and influenza, okay, where your body is showing warning signs. Okay, your body is getting ready to fight against the exterior pathogens. Generally speaking, your immune system is the best defense. It's far more effective than any other herb, than any of the drugs. All you need to do is to let your immune system do its job. Okay, and the way to do that is to make sure you get the blood, you get the macrophage, the white blood cell to the peripheral parts of the body so your body can fight its own battle. And basically that's what I think a lot of the exterior releasing herbs do, right? So now you combine Ma Huang and Gui Zhi, right? So Ma Huang stimulates your metabolism. So your body now gets into a fight or flight condition, getting ready to fight, right? And your body induces sweating, okay? And that means your metabolism is increased. But what happens is when you use Ma Huang, it has the side effect of vasoconstriction, right? Then your blood pressure goes up, your heart rate goes up. But when you add Gui Zhi to it, what happens is Gui Zhi warms the peripheral channel and collaterals. And it does that by dilating the blood vessels. So now what happens is you dilate blood vessels. That is the effect to facilitate sweating. It also has antagonistic effect to counter the side effect of Ma Huang in terms of vasoconstriction. So the combination of Ma Huang and Gui Zhi has absolutely beautiful synergy and antagonism. The synergy is you increase the metabolism to facilitate sweating. The synergy is you open up the skin pores, you open up the blood vessels to facilitate sweating. So they work together so you get much better therapeutic effect. And at the same time, they have antagonistic effect in that Gui Zhi helps to antagonize and cancel the side effect of Ma Huang, right? So that's why if you have taken Ma Huang Tang before, you'll realize that when you take it, you have a very warm, comfortable, mild, gentle sweating type of effect. But generally speaking, you're not going to have too much side effect as far as palpitation or increase in blood pressure or insomnia goes. As long as the formula is prepared properly, is written properly. Okay? If you are the one that has taken Ma Huang as a weight loss supplement before, or if you have taken Ma Huang as a recreational supplement before, then the effect is completely different, because in those scenarios, Ma Huang is generally combined with very strong stimulant, maybe with a lot of caffeine, maybe with Gotu Cola, maybe with others. Okay, so then what happens is they are maximizing the one effect and they are not taking care of the side effect. Okay, so in that case, you have a lot of toxicity problems, you have a lot of side effect problems, and then you have no check and balance whatsoever. Okay, so that is why Ma Huang Tang or any of the classic formula with Ma Huang in it, generally speaking, if you take it, you will get the best effect, and then the side effect is generally kept in check. All right, so unfortunately, Ma Huang Tang, I think, is an excellent formula if you treat the early stage, the first few days of common cold, influenza, and upper respiratory tract infection. All right, to help the patient to fight their own battles. But let's say if the influenza is a very powerful influenza, or let's say the patient's immune system did not quite respond, and a few days go by and the initial battle is lost. Bacteria or virus won the initial battle. And now what happened is they start to go deeper into the body. And what happened is the wind cold usually at this point will turn into wind heat. All right. So now the patient will start to show maybe sore throat, maybe dry throat. Their fever will become more intense. Okay. And if it continues to go into the lung, then it will become lung heat. All right. So it's no longer wind cold, which is generally the first few days of common cold or influenza. It's now wind heat. Okay. So the infection has gotten a foothold in the patient's body. They have won the initial battle. Okay, so now what you need to do is you need to switch gear and use herb that treat wind heat, or if it goes deeper, then herbs that treat lung heat. Okay, so here are two examples of herbs that treat the wind heat. The first one is Jin Yun Hua Lanesra flower. And the TCM description is that it clears heat and eliminate toxins. We'll talk about heat in much greater detail next week, because heat is a very general category. A lot of different things are considered heat in Chinese medicine, including infection, bacterial infection, viral infection, inflammation, fever. They are all considered heat. So a lot of heat clearing herbs would have very different pharmacological effect. But in this case, the clearing heat part primarily describe the effect of this herb as antibacterial and also antiviral effect. So this herb has a little bit of both to treat virus infection and bacterial infection. And if you're interested, here is a little bit more detail as far as which bacteria are most sensitive to Jin Yun Hua. Okay, so a lot of Streptococcus, Salmonella, Diplococcus, Pseudomonas, and so on. And then also what type of virus is sensitive to Jin Yun Hua. Okay, then Lian Qiao, Forsythia fruit, from a TCM perspective, has pretty much exactly the same description or function. And once again, that is to clear heat and eliminate toxins. Okay, but pharmacologically, it is much more of an antibacterial herb and not much as far as antiviral effect goes. All right, so most of the studies that have been done are basically focusing on the effect of this herb as an antibacterial, including Staphylococcus, Streptococcus, Bacillus, Salmonella, Mycobacterium, and so on. And then some mild antiviral effect against influenza virus. All right, but what happened is a lot of time when you have a patient that comes in first with wind cold and that turned into wind heat, you don't really know if it's going to be a bacterial or viral infection. All right, so if you were to combine both of those herbs together, Jin Yin Hua and Lian Qiao, Lanacera and Forsythia, then what happened is, in a way, you have both covered. You cover patient that possibly may have bacterial infection or possibly may have viral infection. All right, so these are the two main ingredients, Jin Yin Hua and Lian Qiao. And as you can see from the name of the formula, Yin Qiao San, it refers to these as the two main chief herbs. All right, and then very different from Western medicine. We don't just use one or two herbs and that's it. Because if you strictly believe that this is a viral infection, then basically all you need is one antiviral herb. But oftentimes that may not be enough because there could be other complications, other signs and symptoms that the patient suffer from. And that's why most of the formulas are somewhere between 5 to 10 or maybe 15 herbs. You need to treat other complications. You need to treat other signs and symptoms. Okay, but in this particular case, Jin Yin Hua and Lian Qiao are the two primary herbs. Okay, so Yin Qiao San is primarily for wind heat conditions. High fever or fever, mild aversion to cold, mild aversion to wind, with or without sweating, and then all the rest of the signs and symptoms. Okay, so this is the TCM description. The Western indication is common cold, influenza, high fever, possibly as a disease go from the exterior into the interior. So these patients may also have sore throat, tonsillitis, periodontitis. It also could be a viral infection, such as herpes. Okay, so once again, early to mid phase of bacterial and viral infection that affect the outside, superficial aspect of the body, generally to the throat, maybe early stage into the lung. All right. One other thing that traditionally Chinese medicine doesn't talk a lot about, but I think is very important today, is the exterior condition specifically related to the skin and also to the nose. Okay, historically when they talk about the skin, mostly they are talking about infectious disease such as measles or mumps or rubella type of infectious disease. Okay, but today we generally don't see too much of those patients. Okay, but what we do see a lot is patients that have allergic conditions. All right, so this is not just allergic condition to poison oak or poison ivy, but rather allergic condition associated with chronic long-term exposure to a lot of allergens, chemicals, toxins, and all the things that are not natural or that are toxic into our body. All right, and what happened is historically, if you have measles, mumps, rubella, and so on, the onset is very acute. You will see it, but then within a few days, generally pass. If you come in contact with poison oak or poison ivy, once again, the onset is very acute, and if you treat it and treat it well, within a short period of time, they will generally pass. But the allergy that we generally see today, what happened is the exposure is generally in a very small amount. And then what happened is we gradually accumulate these toxins in our body, day after day, year after year, month after month, and so on. And eventually it fills up the bucket and spills over, and that's when the signs and symptoms begin to occur. So generally speaking, the symptom is obvious, right? The patient comes in with rash, allergies, skin problems, nose problems, sinusitis, rhinitis, and so on. And you ask them, okay, you're trying to find out what the allergen is. You ask them, did you eat anything different? Did you do anything different? Did you change any cleaners or detergent or soap or shampoo or cologne or whatever? And the patient will tell you, no, 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 everything is the same. So it's very hard sometimes to identify the allergen. And the reason, once again, like I mentioned, is because they, not necessarily because of one allergen at a very high dose, but rather because of where they live, because of where they work, because of long-term, maybe job, career exposure, they end up accumulating a lot of these allergens. Okay, so you need to do a lot of history taking. You need to be a very good detective and gather a lot of data. And hopefully one day you can narrow down exactly what is the allergen that caused the outbreak, either from a skin perspective or a nose perspective. All right. So when you see these type of patients, so once again, this is considered to be a exterior condition, and you can use herbs that release the exterior to treat these patients. All right. So historically, we don't do this a lot, but today this is becoming one of the most important part as far as treating patients go. All right. So these are some of the herbs that dispel wind from the exterior. So wind refers to the allergens, the pathogens that express the signs and symptoms at a superficial layer. If you want to treat the skin allergies, the best herbs are to use are Siler or Fang, which is commonly known as Siler or Saposhnikoviae, Jingjiē, Shizonapetta, or the formula Xiao Feng San, eliminate the wind powder. Okay, if the problem is specifically at the nose, then the best herbs to use are Xin Yi Hua, Magnolia flower, Tang Zi, fruit, Xanthium, or the formula Xin Yi San, Magnolia flower powder. All right, so once again, let's go a little bit more in depth into the single herbs and formulas. All right, so with Fang, the TCM description is to dispel wind and release the exterior. All right, so you notice the TCM description is a little bit different from the Ma Huang and Gui Zhi, right? Ma Huang and Gui Zhi release the exterior through diaphoresis, right? And then you have Jin Lin Hua and Lian Qiao that dispel the wind heat from the exterior mostly by clearing heat, right? So now what happened is Fang and Jingjiē mostly release the exterior and primarily dispel wind. So wind is the factor that comes and goes, much like allergy is the condition that comes and goes with exposure to the allergen. All right. In addition to that, Fang also helps to dispel wind, cold, and dampness, and relieve pain. So when you see wind, cold, and dampness combined together, what that usually means is the wind, cold, and dampness is affecting not just the superficial layer of the body, so not just the skin, but a little bit deeper into the muscles and to the joint. Okay, so that's still superficial, but a little bit deeper than the skin to the muscle and to the joint. Okay, so now the pharmacological effect of the herb, number one, is a lot of these herbs have anti-allergic effect. Okay, so they generally work on the histamine cells or mast cells and the histamine release and they block the cascade, therefore to prevent the allergic reaction, and that's how they generally exert their anti-allergic effect. And the deeper part that I mentioned earlier, affecting the muscles and affecting the joint, these are herbs that generally have anti-inflammatory effect and also anti-arthritic effect. So they help to treat inflammatory disease and they help to treat arthritis. Okay, so Fang is one of those examples. All right, Jingjiē is quite similar. Jingjiē releases the exterior and dispels wind. It also dispels wind from the muscles to relieve muscle spasms and cramps and pain. So once again, the wind part is primarily, it has anti-pruritic effect. So it helps to relieve and stop itching in this case. Okay, and then it also has anti-inflammatory effect to treat different inflammatory disease. Okay, so as far as Xiao Feng San is concerned, eliminated wind powder, once again, Fang Feng and Jing Jie are two of the main ingredients. Both of them release the exterior and dispel wind, and from a pharmacological perspective, one has antihistamine effect, one has anti-pruritic effect, so it stops allergic reaction, and it also helps to relieve itching. Okay. The third herb is Chan Tui, which is a cicada molding. This is also an excellent herb to treat allergy, to stop itching. Okay, but what happens is usually there is very little research on the animal type of herbs. Most of the research are on plant type of herbs. All right, so cicada molding, this is the skin, molting from the cicada. It's an insect, right? So unfortunately, there's not a lot of research that I can show you. But from a clinical perspective, just remember that it's something that works very well to treat the skin conditions. All right. TCM clinical applications, primarily rashes, eczema, skin rash, severe itching, to a point where a patient may scratch it, leading to a lot of leakage of fluids and abscess and so on and so forth. All right. So this is a great formula to treat the symptom of rash, eczema, skin itching, regardless of whatever the cause may be, whether external exposure to allergen or internal accumulation of allergen that subsequently express outwards to the skin. Okay, so when you use this formula, you're going to get good symptomatic relief. Okay, but remember, ideally, you still need to identify and find out what the cause is, and then avoid exposure to the cause as much as possible. And that's really the only way to treat the root problems. Okay? If the allergy expressed mostly at the nose, okay, where the patient has sinusitis, rhinitis, stuffy nose, a lot of runny nose and sneezing and so on. Okay, then two of the best herbs to use. One is Xin Yi Hua, Magnolia flower, and the other one is Cang Zhi, Xanthium fruit. So the description here is Xin Yi Hua dispels wind cold from the superficial parts of the body, but specifically from the nose, and it helps to open the nasal orifice. Okay, so specifically, this herb is to dispel wind cold from the nose. Pharmacology-wise, it has anti-allergic effect, it has antihistamine effect, and it has marked benefit to open the nasal obstruction and shrink the nasal mucosa. All right, so these are the primary benefits of Xin Yi Hua. Generally speaking, this herb is very safe. There's really no side effect or caution I need to tell you, except that if you use this herb in decoction, make sure you put the flower inside some type of cloth cover or cloth bag. And the reason is because the little fiber-like particle on the flower, if you don't cover it up, it's going to be present in the decoction. And when you drink it, it's going to irritate the throat. And for a lot of people, it's going to cause gag reflex and cause nausea and vomiting. All right. The other herb that's frequently used is an herb called Cang Zhi, Xanthium fruit. And the description is it dispels wind and dampness to relieve pain, and also opens the nasal passage and relieve pain. All right. So this is an herb that helps to dispel wind, but generally speaking, wind in addition to heat, wind in addition to damp. Okay. So what that means is not so much as a wind that comes and goes, but more as a wind heat that causes a lot of inflammation and pain, or wind damp that affects a local area, stays for a while and won't leave. All right, so not just a nose allergy, but probably more in terms of sinusitis, rhinitis, inflammatory disease, maybe even to a point of infectious disease, as in sinus infection. All right, so Tang is more effective for the more serious infection and inflammation of the nose. So sinusitis, rhinitis, and maybe sinus infection. All right, primarily has anti-inflammatory effect. Okay, if you do use this herb, okay, or if you're not familiar with it, remember, in most of the classic materia medica, you will classify this herb as being slightly toxic. Okay, but what really happened is if you use this herb as a raw and processed herb, it's actually quite toxic. You need to make sure you dry fry the herb until most of the superficial parts of the herb is slightly charred, slightly burned. And a good indication is it needs to be dark brown, slightly black, and at the same time, little spikes on the outside of the fruit need to be dull. Okay, and that is an indication that the toxic compound has been deactivated by heat. And the toxic compound is here called carboxyattractyloside. Okay, so dry frying process is what helps to deactivate and eliminate the toxic compound. And at the same time, the toxic compound is not soluble in water. Okay, so if you do use this herb, make sure you use water as a medium, so you end up extracting the active ingredient. But don't use alcohol, don't use ethanol, don't use it in tincture form, because it will help to extract more of the toxic ingredient. All right, then don't overdose. So the general raw herb dose of this herb is about 6 to 10 grams. So keep it within that range. Okay, and lastly, the toxicity of this herb when it's not processed properly, or in cases of overdose, is mainly to the liver and to some extent to the kidney. Okay, so I would say if the patient has a pre-existing liver or kidney disease, then avoid using this herb if at all possible. Okay, because I think in those cases, the risk is far greater than the benefit. So there's really no need to use this herb. Explore and use other herb instead. All right, but if you happen to have overdose or adverse reaction associated with use of Tang, once again, these are the herbal antidotes. Okay, and also acupuncture treatment for adverse reactions. All right, so just so you know, in the course of doing research and writing a lot of text and preparing for this formula, I have probably around 12 to 15 books on the safety and toxicology of Chinese herbs. And this, once again, is something that the Chinese doctor have gathered through about 2,000 years of clinical trial and error. So what happened is a lot of doctors, a lot of patients have unfortunately suffered from adverse reaction associated with herbs. And these are their real life experience as far as what are the signs and symptoms and what you can do to treat the overdose. Okay, so I think they are very, very valuable. Most of the TCM textbooks will only tell you that it's toxic, and it doesn't tell you how it's toxic, why it's toxic, what you can do to minimize the toxin, or what you can do to as herbal antidote to treat the overdose or adverse reactions. So since all that information is out there, is documented, I think we really owe it to the patient to know it and to have it available if we should happen to come across it. So that's why in all my presentations, when there is a problem, if there is a solution, I will also present it to you at the same time. Okay, so that way you know the problem, you know the solution, you know the effect, you know the side effects. All right, you see the whole picture of how the herbs can be used and so on. All right, so formula wise, if the patient has a nose allergy type of problem, then Xinjisan Magnolia flower powder is by far the best herb to use. Okay, so in this case, you can use this formula, and this is the TCM description as far as indication go. Nasal obstruction caused mostly by wind cold. So this is more of an allergy, this is more of a nose problem. associated with common cold and influenza. All right, and these are the Western diagnosis or indications: allergy, allergic sinusitis, rhinitis, sinus congestion, sinus headache, and so on. Okay, this is also a formula that I would encourage you to be creative in terms of dosage form and route of administration. And the reason I say that is because we know the affected area is the nose, right? So how do you get the medicine to the nose as quickly and as effectively as you can, right? So the old school way is to give it by mouth, right? Maybe decoction, maybe capsules or tablet. But once again, that's going to take at least half an hour, if not longer, before you can swallow the herb, digest the herb, absorb the herb from your intestines, have it go to the liver, and remember, liver is first pass, so it's going to deactivate a lot of the herbs, and then go to the blood, and then circulate back to the nose before it starts working. So you're looking at least half an hour to 1 hour, if not longer, and also a lot less of the herb get to the disease area. So one way to be more creative is to try and think about how can you get the herb right to the nose, right? So one way is that if you are using a decoction or if you are using the powder extract, okay, mix it with hot water, and instead of letting the decoction or herb sitting there and let the steam or the essential oil evaporate and you lose all that effectiveness into the thin air, what you can do is make a little tent with your hand and inhale the steam into your nose. So now what happened is the vapor, the humidity will help to hydrate your nose, and all the active compounds that are present in the essential oil that is evaporating will now start to work on your nose right away. Okay, so that's one way to quickly and effectively get the herb right to your affected area. And generally speaking, you do that first, and then when the decoction or the solution cool down to warm or a little bit above room temperature, then you can swallow the entire solution or decoction. All right, that way you have immediate effect, you absorb it, then you end up with sustained and prolonged effect all at the same time. All right, so that's how you get the both out of this particular formula. All right. Now let's switch gear a little bit and talk about some of the more contemporary formulas. So these are the Evergreen Collection formulas. Okay. Obviously, the best thing to do is prevention before treatment, right? So before the patient actually gets sick, if you can help to strengthen their body, boost their immune system before they even get sick, then obviously that's the best because they can bypass all this in the first place. Okay, so historically, your immune system is basically the Wei Qi in Chinese medicine, or the defense Qi. Historically, you can use a classic formula called Yu Ping Feng San, the J windscreen powder, so that's perfectly fine. You can also use Immune Plus, and they share the same active ingredient, which is Huang Qi astragalus. All right, so Huang Qi is a great herb to help to boost your immune system. So as winter seasons start to come around, okay, as people around you start to get sick, this is a great formula to take. I would say probably start taking it maybe a week or so, and that way you give your body some chance to take the herb, benefit from the herb, respond from the herb before they start working at their best. Okay, if you already see warning signs and symptoms, then it's too late. So once you start to see the warning signs and symptoms, right, that's the early stage of the wind cold. Then what you want to do is use classic formulas such as Ma Huang Tang Ephedra decoction or Gui Zhi Tang cinnamon decoction, or if that warning sign period has passed. And in the US, what happened is patient may not come to us right when they had the warning signs. In fact, most of the patients will try to see if they can recover on their own. So the very first few days of the warning sign, usually they are still at home. Usually they try to get over it on their own. So by the time they get to a Western medicine practitioner or a TCM practitioner, oftentimes you will already turn from wind cold to wind heat. Okay, so at this point, it's no longer enough to help the body to help itself. You actually need the herbs to actually help to fight the infection alongside with patient's own immune system. right? So at this point, we use Qiao San as a classic formula. You can also use Lanisera complex for the collection formula. And once again, two formulas are very similar. Jin Yun Hua and Lian Qiao are two of the main active ingredients. But in this case, Ban Lan Gen and Da Qing Ye, which is Isatus root and Isatus leaf, are also added to increase the effect of antibacterial and antiviral effect. Okay, that way it helps to cover different bacteria and it helps to cover different virus. Okay, because one of the things we're going to see more and more often is the mutation and resistance of bacteria and virus. All right, so sometimes you just never really know what bacteria and virus you're dealing with. Okay, so in a way, this will give you more safety net because they will cover more of different bacteria and virus. Okay, if the infection is specifically affecting the upper parts of the body, specifically from the throat and on upwards, right? This is a great formula historically to treat infection of the head. All right, so we call this formula Herbal ENT, which is herbal formula to treat heat affecting the ear, nose, and throat. Okay, overall, most of the herbs are bitter and cold, so a lot of them have excellent antibacterial and antiviral effect. Okay, two of the main ones are Huang Scutularia and Huang Lian Coptis. All right, so these are two of the herbs we'll talk about quite a bit next time when we talk about heat clearing herb. But for now, this is one of the best formula to treat infection of the ear, nose, throat, the entire head. Okay, this next formula is one of the most interesting formula, at least for me. And the reason is because, once again, we talk about bacteria and virus mutating on a regular basis. So in the US, the main problem that MDs face is a mutation of bacteria and virus to the antibiotic drugs and antiviral drugs. In China, in Taiwan, in Asia, most of the TCM practitioners, most of the problem the TCM practitioners face over there is the mutation and resistance of the bacteria and virus to the herbs. Okay, you may think, how can it be? How can the bacterial virus mutate and become resistant to the herbs? Well, if you think about it, most of the herbs have been used through trial and error, right, for at least a few thousand years, right? So those few thousand years, what happened is the bacteria and virus are living organisms. They don't want to die. So they're going to do whatever they can to survive. And mutation is their main defense, their main resistance. So what happened is you do come across studies that talk about bacteria and virus that mutate and become resistant to a lot of the classic single herbs and a lot of the classic formulas. And if you think about classic single herbs and formulas that have antibacterial, antiviral effect, what happened is most of them are yellow type of herbs, right? Huang means yellow. So you have Huang Lian, Huang Qin, Huang Bai, Da Huang, and so on and so forth, right? So if those Huang yellow type of herb happen to not work because of mutation and resistance, then you need to use other herbs that the bacteria virus have not seen before and therefore are not resistant to or are susceptible to, right? So what happened is there are a lot of indigenous herbs from the southeast region of Asia that work very well, but in mainland China, they have not used it, and therefore, in most cases, there's no resistance or mutation, all right? And that's basically how this formula is constructed by Dr. Jimmy Chang, that he uses a lot of Huang type of herbs that are not commonly used, so most of the effect will remain very potent and very effective. And you see here, there's Cha Ci Huang, Hu Yao Huang, Liu Zhi Huang, Su Wei Huang, Ya Se Huang, and so on. So basically, these are a lot of bitter and cold herbs that have excellent antibiotic effect. All right, so you can use this in a way as a last resort. If all else fail, it's going to give you good assurance and good confidence that it's going to work well. All right, this here similarly is a lot of herbs that are bitter and cold, but in this case shows more antiviral effect. Okay, so once again, if the classic formulas do not work, then this will be a good last resort, as it has many ingredients that treat many different type of virus. Okay, if the patient has sinusitis or rhinitis, basically the allergy-related type of nose problems, Magnolia Clear Sinus is similar to the classic formula in Xin Yi San, in that it helps to release the exterior, open the sensory orifice, and it has a lot of herbs here that have anti-allergic and antihistamine effect, mainly to treat allergy-related nose problems. Okay, so this is more of an allergy. And then Pueria Clear Sinus is stronger, it goes deeper, so it's mostly to treat chronic sinus infection type of problems. So the formula is more bitter, it's colder, it has a much stronger clearing and draining type of effect. And Silorex is primarily to treat the skin, so for skin allergy. But once again, when the symptom shows up at the skin, it's mostly a symptom, it's not the cause. Okay, and then Dermatol Damp is for treating damp type of skin rash and itching and eczema. So basically, as you look at the skin, it should look wet, it should have some fluid, it should have some dampness to it. Okay, and Dermatol Dry is to treat a dry, scaly type of skin condition. Okay, and once again, both of these formula that are used by Dr. Jimmy Chang, and he find it to be very effective for all kinds of skin conditions. And once again, they are more for symptomatic treatment. All right, and this here is probably the most important thing you want to keep in mind if you do treat allergy. And this is a TCM proverb that says, one cannot treat the exterior wind without treating the interior blood. Okay, one cannot treat the exterior wind without treating the interior blood. So the exterior wind refer to use of herb that treat the wind and dispel the wind. It's great to treat the symptoms, but you're always going to be one day behind as far as chasing the symptom. In order to treat the root cause, you have to treat the blood. And even TCM in the past already know this. And what that is the blood is referring to the slow, gradual accumulation of the allergens, the toxin, the chemicals in the body. It could be lead, it could be heavy metal, it could be herbicide or pesticide or chemicals or perfume or whatever the toxin, the allergen may be. So once again, we live in a world that have a lot of unnatural toxic chemicals and substance. And as they get into the blood, they accumulate in the fatty tissues, in the organs. They float around in the blood. They get to different parts of the body and eventually express outwards to the skin. All right. So once again, if you are treating the symptom, if you are treating the skin, if you are treating the wind, that's great, but you're always one day behind. So you need to recognize and treat the blood. You need to recognize and minimize the exposure to the toxins. And if you want to treat the blood, then what you need to do is basically treat blood heat and treat the chemicals, right? So these patients usually have blood heat, and the heat refers to the inflammatory condition that body has to get rid of it. And also treat the underlying deficiency, because as the patient have these inflammatory conditions, the heat over time will damage in. So these patients will almost always have a lot of insufficiency heat. Okay, so remember to treat and nourish the insufficiency and also clear the deficiency heat at the same time. Okay, and here are some formulas to consider. One is herbal detox, and this is a classic formula historically used to treat all kinds of toxic reactions. Toxic reaction from ingesting poisonous mushrooms, poisonous food, exposure to heavy metals, or whatever the chemical or toxin may be. So this is basically a formula to help the body to flush out all these undesired offending substance. It's a formula to help protect your kidney, help to protect your liver, and make sure your organ stays and able to perform its normal function. But primarily to help the blood to flush out the toxic compounds. Okay, the next formula is more specifically for the liver. All right, so this is a formula with a lot of bitter and cold herb that helps to drain or eliminate dampness, damp heat from the liver and gallbladder. Okay, or in other words, they protect the liver, reduce the inflammatory condition of the liver, so it helps to protect the liver and facilitate the liver to carry out its function, which is to metabolize and deactivate all the toxins. All right, so liver detox, that's the main function. And then the last formula is kidney detox. So this is a formula, once again, to help the kidney to do its job and to protect the kidney. All right, so it's helped with elimination of the toxins, elimination of the allergens, and so on. So these three formulas, herbal detox, help to get rid of the toxins from the blood. Liver detox help the liver to perform its job and to eliminate and metabolize the toxins. And kidney detox help with the kidney to do its job and eliminate. And then lastly, if you need to nourish in, then it really depends on which part of the body is most damaged. It could be lung in, it could be liver in, it could be kidney in, it could be different parts of the body. So you need to see exactly what the patient has and then choose formula accordingly for those particular conditions. All right. So that basically concludes my first hour of talk on the exterior releasing herb. So once again, exterior condition in TCM as we see today primarily refer to the initial stage and the mid stage of common cold, influenza, and upper respiratory tract infection. So we talk about many of the options as far as treatment goes, and we talk about their effect, their side effect, their caution, their contraindication, and their possible herb-drug interactions. So hopefully you have a good idea of when to use those herbs, when not to use those herbs, and when to be careful. And then, obviously, I only talk about 2 or 3 herbs from the single herb and 1 or 2 formula from the formulas. Okay, so hopefully at least that give you an idea of, so this is what TCM means as far as exterior syndrome or exterior releasing herbs. And if you need to learn more, then these are some of the books that me and a lot of other practitioners have written. This one is called Chinese Herbology and Pharmacology. So it looks at the Chinese individual herbs from both herbology and pharmacology perspective, much like how I'm teaching this class. And then also Chinese herbal formulas and applications. So this is a book on the herbal formulas. Okay, so once again, looking at it from a TCM and Western medicine perspectives. And then for the collection formula that I mentioned, more information is available in the clinical manual of Oriental medicine. All right. So hopefully that 1 hour into exterior releasing herb is something that you find useful, whether you are a beginner or advanced practitioners. And once again, if you have any questions at all, feel free to send me an email. I'll be more than happy to answer whatever question you have. And my email address is john.chen@evherbs.com, or you can contact Lotus Herbs, Lotus Institute, and they'll be more than happy to direct your question to me. All right. Thank you very much, and I'll see you next time.
Okay, thank you, Dr. Chen, for a great webinar today, and thank you all for joining us. I hope you enjoyed today's class. The next 1 hour class by Dr. Chen will be next month. Please check our website, eLotus.org, for the schedule. That's it for today, everyone. If you want to rewatch today's class, we have recorded it, and it will be available on our TCM Wisdom tomorrow. Thank you so much, and have a great weekend and rest of your day.